welcome everybody to this special one-off podcast that I am joined in the studio by Gregory Hill O'Connor. Lovely name there, great name. Strategic Planning Advisor, Community Engagement, System Redesign Directorate, Healthcare Improvement Scotland. What a title, what a title. We know you as Greg. So Greg, are you well this morning, sir?
I'm very well, thank you very much, Colin. Thanks for having me.
No, it's a pleasure. It's really nice to have you in the studio. So we're here to talk about the mental health and substance use protocol, but before we get to that point there, if it's okay with yourself, Greg, Healthcare Improvement Scotland, I think the listeners, people tuning in, would really like just to hear, what is Healthcare Improvement Scotland? What are you about? And also, that long title sounds like you are the master of all within that organisation as well. So what do you do and what is Healthcare Improvement Scotland?
Yeah, thanks, Colin. It'd be good if I was the master of all things. I'd maybe enjoy that role, but I'll keep that on the down low for now. So Healthcare Improvement Scotland is what's known as a special health board. So it doesn't necessarily sit, it has a national remit, and as the name suggests, it has a national remit around improvement. There's a lot of different functions within it. A lot of them are statutory functions. So a lot of you might know or understand Healthcare Improvement Scotland as an inspector. So there's a inspection remit within it. We also have the Scottish Medicines Consortium, which looks at evidence around any new medications that might want to be used. We also have, my part of the organization is the Community Engagement and Transformational Change Directorate, and that's looking at kind of has a specific remit around community engagement. So whenever there's a big change within a health board, there needs to be a certain element of engagement with community stakeholders, so they provide support for areas who need to do that, and they have local officers. So you'll have one where you are, and also then looking at how that links to the idea of transformational change. We work on a national basis on a number of pieces of work. So a lot of them are very health oriented. So we have a lot of things around frailty, a lot of pieces of work around dementia, and a lot of that is just helping teams improve certain areas of their work. So falls prevention, infection control processes, that sort of thing. We've started recently looking at things like mental health as well, and substance use. So that's kind of a relatively new area of work for Healthcare Improvement Scotland, but it's something that's deeply ingrained within a lot of what we do now. And that's, looking at, again, we've been working around early intervention in psychosis and personality disorder. And then more recently looking at specifically mental health and substance use and how they intersect. And most of the support that we're doing is working, with people like yourselves, Colin, to understand some of that broad strategic stuff, because there's a lot of things going on, and it's not necessarily within things that need to happen within one service. There's a lot of coordination that needs to happen. So it's working with people, but then also all the way down to how do we support staff? We've been doing a lot of work around kind of workforce development, training, helping build relationships, giving people the space. So it's looking at that idea of the transformational change is looking at that top to bottom approach of coordinating these things and making sure that everything sort of facilitates change to happen. I hope that answers your question.
No, it does. I think that word change, though, can often come with excitement. Also can come with a bit of fear, if I'm being honest. It's an ever-changing landscape out there, as we say, and I think especially which we're away to talk about is mental health and substance use that you mentioned there, and even being relatively new in Healthcare Improvement Scotland at looking at it as well. Although mental health and substance use has been around for years and years and years, and I know people working in the field of mental health and substance use have been challenged to try and create change for many years around working better together, looking at how things can be better outcomes for patients, for people, for communities in doing that. So I think that whole part there that I started the show by saying, mental health and substance use protocol is what we're here to talk about. But I guess it is, and looking at that, and looking at that, what's this all about? What is coming together and creating this protocol, and what, and I guess that whole part again, from Healthcare Improvement Scotland, you were saying there, Greg, all these different arms of that, but bringing that part that you do together, and I really like that understanding about staff change and staff development. What does this mean? What does it really mean having a mental health and substance use protocol?
Yeah, I think I just picking up on that thing you said about change, and one of the things that I think about is in terms of how we approach change is, and that's why I guess that is what this is all about, is one of the guiding principles that we have as a team, as an organization, is hearing what people need and picking up, because there's staff across the system, nobody's saying we don't need change. I think what the issue has often been is there's not been an understanding of what change is required in many ways and how that's done. So as you say, this has been going on for a long time. One of our presentations that we often give, we say, one of the key reports around mental health and substance use was published in 2007. I think it was called Closing the Gaps. And that basically said there's big gaps between mental health and substance use services. People aren't getting the support they need for this, and there's quite a big overlap of people who need that, but the services aren't quite keeping up. So we know and so one of the things that we're looking at is that idea of the implementation gap. So we know what needs to get done. That's been around. So what the support that we're hoping to provide is finding out how do you do it. So in terms of what we've been asked to do, as a program, in terms of, you've been mentioning this elusive protocol, and basically where that came from, and it does feel quite elusive because it's not real until you're doing it, you're living it. So so we were asked by the Scottish Government to develop a national protocol for mental health and substance use services. That came off the back of a really, really good report called Ending the Exclusion by the Mental Welfare Commission. This was followed by a rapid review of the Scottish Government, and they said, the first recommendation was every area needs to have a protocol on how mental health and substance use services support people and work together. So that's what we've done. We've written that kind of good practice, national approach, which we're calling the Mental Health and Substance Use Protocol. We kind of see that as a framework. So again, there's a lot in there, and we were keen to make sure that it isn't just another list of things that need to get done, but it's also a list of things that need to get done to make sure that the things that need to get done. And we just suppose is a convoluted way to say, a lot of things are about creating the conditions. So yes, we want staff to be able to work together across services, right? But what support, you can't just say go do that. There needs to be, how do people feel safe in doing that from a clinical governance point of view? How do people feel confident doing that from a skills point of view? How do people trust, from a relationships point of view? So there's a lot of that we've built into this protocol, and I guess that's where that's coming from in terms of that change. Because we know that there's a lot of standards out there. We know that there's a lot of guidance, and I guess part of what we're hoping to achieve with the protocol is bringing that together in a way that says this is how you can do all of that. So what we're hoping from, I suppose, this exercise really is, I guess, doing a bit of taking stock, because based on that idea that there's a lot of work that's been done. There's a lot of work that's been done in, the MAT standards is a big one. It's been incredible the amount of work at such a high pace that's been done in Perth and Kinross and everywhere else. It's been quite interesting to see, because I know that it's been very stressful, and we've learned a lot from how that's been done and been approached. But it feels like now's a good time to take a bit of stock of where that is. but also in terms of looking at what, because we, as you said, this is not a new issue. People having co-occurring mental health and substance use. It's not a new issue at all. So I'm assuming that the staff within your services have ways of supporting people to do that. I'd like to hear that as well, because even though that might not be a response to somebody saying this is how you should do it, you've people do workarounds. People make things work, and we kind of want to hear that as well in terms of how that's going. Because again, I think that's a lot of it in terms of relationships. Is you can have a referral form. I think we said this early. The gold standard for me is, when you say, can you tell us about a good relationship that you have with another service? And they say, without a doubt, there'll be someone in that workshop who says, oh, I feel I can just pick up the phone. And I think that's what we also would like to hear is what helped you feel like you can pick up the phone, and how might that be put into kind of either more formalized, how can that be improved? How can that be brought into the conversation so it isn't just you feeling like you're on your own as a staff member with another staff, but kind of muddling through it, as it were, and no doubt doing your best, but how do you bring in that support in the background?
So I just want to come in there if it's okay, Greg, because I think all that is it's painting a really good picture of where things actually are at the moment, because I think you're right. In everybody's service, someone knows someone on the other end of the phone where they pick up and they do that. And I think um, I've heard in workshops before, that's as good as those people being in on that day. That doesn't mean everybody else doesn't have friend relationships in other areas, but they're usually sort of key people who have built up something between, and because we're talking about substance use and mental health, we'll use that. Um, but there is often there's not a formal sort of process in that, and I think sometimes when we talk about formal, we everybody sort of gives a bit of a oh, this just means another bit of paper, probably another something else I've got to fill out, something else. And I think staff and also managers and stuff, there is a bit of disheartened sort of, oh, are we going to do something here again? But from what you're saying there, this is really much about everybody's stories. Really, it's about listening to staff about how they are working at the moment, what actually has made things work. Don't get me wrong, in some areas it might be processes that I've got really written down and this is exactly what's done, but there's lots of components, isn't there, to this sort of this elusive protocol it is there at the moment. There's lots of components around there, isn't there? It's you're wanting to hear it all. Even, I suppose, if I can say this as well, even things that maybe have not worked, so that you can kind of go, oh, actually, that makes sense. That didn't work like that, but we might have done that, or we might have asked, or people in other areas might have done that because they think that is the one thing that is going to work. So it's a kind of a chance to get out there, and as you say, I like that stock take. We're not very good, and I'm going to say from, again, just from conversation, we're not very good when it comes to services of taking stock. We don't kind of go, well, that's out of date now. Let push that to let's take that off the shelves as such. Let's try something new. We tend to just always continue just moving forward, move forward, move forward, and not kind of take stock. So I like that idea of also let's stop, let's take a bit of stock. And I guess it's for managers, and maybe that's one of your asks, I guess, is of managers and seniors to give that permission for people to also stop and take part in doing this. Take part in looking at how can we develop and improve the working relationships between mental health and substance use. Would that be fair to say as well?
Absolutely. I think that comes really to the core of what we want to be talking about, and what we'd like you to be talking about within staff conversations, and I guess the things that we'd like to hear from people. I know, going back to my sort of, convoluted job title, strategic planner. So I've got, what you might a planner's mindset. So, coming into this work, and we've been working together for what, 2 years now, coming into this work, and I'm like, processes, right? We need to make sure that if this person with it comes in, what, if you find out, you tick the button, then and very quickly that that was dispelled, and I thank all of the staff that I spoke with who pushed back against that very regimented approach that I kind of came into. And basically kind of where we're at with essentially complex needs is how do you create space for staff with different points of view and different expertise to come together and discuss what a person needs. And then within that space, how do you make sure that there's the right information within that space to discuss? And then there's also the right levers for action. So once you've decided how do you then access that support that that person needs, whether it's in your service, whether it's with somebody else in somebody else's service. And I think that's really the core of a lot of that, of where we're hoping to get to. And how do then people feel, staff feel confident in those decisions that they've made. And I think that's really the key to it. And processes can be there and they can be supportive. And so I guess, again, going back to that, what do we want people to be talking about in these conversations that will feed into this self-reflection? As I say, clues in the name, it's the reflection. So, if we wanted processes, if we wanted to know, because one of the things in the protocol is there's shared or there's agreed assessment and screening. So there's agreed ways that you get information from a person about what they need. I could probably Google that and find out, from one of your strategy, or I could just ask you, Colin, and you could tell me if you've got a process. And I think, we will have that conversation. But what I would also like to know is what would be also, I think really informative is that a good process? Do you use that process? Is there anything that you think would be better? If you don't use the process, why not? And again, very much in that mindset of we want to make it better. So it's not like, why aren't you using it? It's more like, tell us how we can make it more useful, because there's no point it's sitting on a shelf. It's not helping anybody. And so it's that idea, and it comes again back to that implementation gap. You can have all the standards you like, but things need to be real and things need to work through. And that's kind of what we want to hear about is, we talk a lot about lived experience of people accessing services, but I suppose what this is almost like, what's the lived experience of working in a service, I suppose, and hearing those stories. So yeah, and then it's also, again, I suppose, thinking about what do you do maybe instead. Again, as we say, we talked about some of those, workaround sounds like you're being, bad, but, like, what is it that you do? What is it that staff are doing because they're facing a really high stress situation and someone's really needs, and I'm dedicated and want to provide that support for that person. So what's happening? Yes, it'd be great to hear about that, and it'd also be great to know about what's lacking as well. So what do you feel that you'd like to be able to do but you can't for whatever reason? Whether it's needing advice, because that was the other thing that one of the things is some of the things around mental health and substance use. There's a bit of a worry that you have to provide kind of almost like full clinical interventions, but but actually sometimes it might just be you need a bit of advice from someone with specialist skills. So you might be sitting in the CMHT and then there's someone who's using substances and you're a bit like, is that going to be, do they need, and again, this is where that picking up the phone, is it a case of, you just need advice, you can probably manage that person with a bit of peer support from another member of staff. Is it that, or, is it, oh no, this person needs a full assessment and joint working with the specialist service. So it's kind of having to think about that as well, and how that might support you, and basing that on kind of stories from clinical services, I suppose.
So, Greg, for the listeners out there. So there are a couple of things for the listeners out there. I am sitting here on camera smiling, listening to what you're saying there. One again for the listeners, it's quite visual watching Greg at the moment and his hand movements of trying to really very passionate about trying to make this happen. A lot of like big hand movements of this is what we could do, this is how we do it. Now, and again for the listeners, the people probably will know that I manage substance use service, and I'm not just the host of this podcast show at the moment, but I also manage substance use services. And it's really interesting you're saying there that we have worked together now for a few years now, and really honest of you as well, saying about, in that title of your work about strategic planning advisor, you came in with a picture, I think, of what you thought. Like, here we go. Let's get this. Let's get a map out here on the wall. Let's follow this map. Let's follow this train journey. This is what we can do. And using yourself as well, just saying that, that's not. That maybe still has to be there. I'm not saying it doesn't have to be there, but things are different. And hearing that from staff, I think, is just that bit that I'm smiling about. That giving staff the chance to be heard, and also as I said, what's working, what's maybe not working, how can we do things better? Because the one thing I hear from staff often is they don't get the chance to maybe stop to actually take stock. So I suppose as managers, my role and my colleagues from mental health services and team leaders from substance use services and mental health services, it's that I mean I'm here today saying I'm going to give permission for that to happen, because we want people to get on board and take the time to come together to do a bit of self-reflection on what is working, and as you say, that sort of that service user but staff user journey, because I think sometimes we don't do that as well. We might listen to service users and patients on their journey, but staff have a journey in themselves, especially around this. I think it's vitally important. So I suppose that next step is, we've been talking off the show in the green room beforehand about what we're seeing about moving forward here and how this also contributes. And I'm just going to touch on this before we kind of how this contributes to the MAT standards, especially MAT standard 9. I've always got to make sure it is MAT standard 9, although it is relevant to all MAT standards in regards to this. But and I think that's a thing as well. We kind of focus on that MAT standard 9 because it says mental health and substance use, but actually the theme of this is taking a bit of stock of looking at all the MAT standards actually, and how does this benefit. But also, can I ask, one of the things we're looking at in Perth and Kinross, and I know that you might share this show podcast with other areas as well, but are any other areas doing anything just now? Is there, I know there's talk of in Dundee, and I think they've got a hub. One of the things you were talking about there was just that people coming together with their expertise and being able to join that together and some of the stuff. So maybe just for our listeners, that's happening in Dundee, isn't it? There is a chance where professionals are coming together and using their skills to, yeah, to benefit and improve outcomes for people, but especially around mental health and substance use. Am I right in saying that is it a hub? Is it a meeting that's taking place?
Yeah, so it's both in Angus and Dundee. So I think Angus they had their hub model, which was actually referenced in the end in the exclusion report that I mentioned, where this protocol came from. It was referenced as an example of good practice. And yeah, essentially it's basically for them it's a referral hub. So the referrals come in, and they can discuss, because we know one of the main issues is the notion of rejected referrals. That's a big barrier. Talk about ending the exclusion, that's the name of the report. And what that is there's basically there's a lot of debate around which services someone with co-occurring needs is best. But what nationally was found was that conversations weren't happening about that. It was just not my service, not my service, hence exclusion. So we want to end that exclusion. So the Angus model was, the Angus hub was highlighted as a way basically where services would get together and they would have that discussion, input, and talk about where the most appropriate and what the most appropriate support for that person is. And they also included third sector services in that as well. So again, one of the things that we see about co-occurring needs is actually, yes, you might have quite significant substance use needs, as well as significant to the person mental health needs, but doesn't necessarily meet that threshold for community support, but definitely needs support. And there's third sector services, so it's making that joined up. That approach was sort of replicated to some extent in Dundee, where again it's a multi-agency meeting where staff within community services, so community mental health, and DDARS, so the Dundee Drug and Alcohol Recovery Service, as well as third sector. So I think they've got Penumbra are represented on that group as well. I think Hillcrest as well. So there's ways in there. And one of the key things that they've been able to do is really streamline the connections between those services. So yeah, so that's and then in terms of what we're going to do with that, because I understand, we're going to be exploring a version of that for Perth and Kinross. So we're building on some really good examples, but we want to make it relevant and locally suitable. So a lot of the information from these conversations are going to feed into that. So again, while there was drawbacks to my planning brain at the beginning, I think one of the benefits of having this strategic planning approach is one of the things that we always talk about is activities on different horizons and different timescales. So again, Closing the Gaps came out 2007. There's a long-term vision that we need to have in order to do this. There's a medium and there's a short. So all this information will be used and repurposed. So some of that short-term vision is going to be into those hubs. How do we design them? What do they need to look like? What are the groups? But then it will also then feed into a medium-term vision around how do we expand the kind of the circle of collaboration. So already we're talking about inpatient crisis care. There's things about primary care. How do we grow that conversation? And then that long term is how do we embed that strategically through and this is maybe getting a bit too ambitious, but looking at things like how do we further integrate some of that so it isn't just necessarily hubs and things. It's kind of ongoing collaboration. So that's in terms of what we're going to do with what people tell us is just going to use it for as many different kind of things to inform as much work as we can. But that immediate one, which I think would be hugely beneficial to informing what do you want to achieve from having something like a hub, and what does it need to look like in order for staff to use it, staff to feel supported by it, and staff to get the benefit from it, as well as, because we know the benefit that it will have from people. People have been telling us that this is one of their biggest issues. So that's why we now want to hear from staff about, well, what does it need to look like?
So you said something, and I'm going to I'm going to say a couple of things here, and then we'll just look at the time in the show. But so So I have, and because some of the listeners will know yourself, Greg, and they'll know myself as well, I'm going to put this out here first as a statement. I do not have a thing about trains, but I often use this as an example of when I'm talking about things. And people always say you must have a thing about trains, or the underground is often what has been said about myself. So you used this word here, circle of collaboration. I really like that. There is in Glasgow, there is an underground. Most people know there is an underground. It doesn't go much further than a circle, to be perfectly honest, but it supports a whole city in doing that, and it does. It supports the whole city, and I often think as well when you look at London Underground, the London Underground map, it looks quite confusing. All it really doing is supporting a city. People being able to get on and get off. And that sort of closing the gap, and I'm going to say mind the gap. I think we talk about gaps, but how do we bring them closer together? How do we stop those from being gaps? But I do often use that because, especially in Glasgow, many years ago, somebody from Glasgow City Council phoned me up and asked if they could use some of the things I'd been doing in a workshop, and they used that, and I'd never thought of that. Just when you said that circle of collaboration, I think that's a really good way of putting it around that. Around that is all it's doing is supporting a city, and if we can get that, and with our staff, in that circle of collaboration of and supporting a person in return, supporting a community and doing that as well, I think that's a really nice way of putting it. So the bit is now is what is next, I guess, and it's not. And I know you're probably going to put that back to me, Greg, and that's absolutely fine. It's what is next can we do, and not what with the help and support. You're not going to get off that easily with the help and support of Healthcare Improvement Scotland. But what can we do? Because I know, so just through your conversation there, or through our conversation, we're looking to hold we're going to put this podcast out. That's one of the things we're going to do, so people get an idea of what we're talking about here within the protocol. But also, let's take the protocol to the side, because that's the sort of title we gave, is really hearing the views and the opinions and the stories from staff that will start to build a picture of what is actually needed. in return, probably a protocol come from that. But we need to get those views. So I know one of the things we thought about was we're going to have a workshop in doing that, but we'd like people to be prepared for that workshop as well and think of a few different questions or think of a few different things that could be done in preparation for that. So just, yeah, putting that back to yourself to put to us, what are some of that, what's some of the idea around that?
Yeah, so I think, as you mentioned, we can do a workshop, but I think there's also benefit in just having conversations within team meetings, within as many different forums, that already exist, where there's colleagues who feel comfortable kind of talking about things with each other. So there's going to be some kind of key questions that we'll send
Yep.
out, and share alongside this to support that. And there's going to be an online form that you can just fill in. And basically, we just want information. It's free text. It's not like, I think there's maybe some ratings on there, but what we want is that free text narrative, and we just want to hear those conversations that you're having. One of the benefits, I think, and I sort of have to say, but I think we've got this from feedback. One of the benefits of having Healthcare Improvement Scotland involved is that we're a bit neutral in a way. So we'll take that away, and we'll put it together within that self-reflection tool, and basically identify where things are going well. So one of the sort of tick boxy bits is we want to write a protocol. We want you to have a local protocol. So what is it that you've got already and that you need to write up, or that is ready to kind of be put into that? So that's that taking stock bit. And then there's a bit of an improvement plan or an implementation plan that needs to go alongside that we're going to work to develop, in terms of things that you've identified or things that have been identified within these conversations that need improving in order to deliver on what is it within that protocol, which in itself has been informed by conversations with staff. It's been informed by evidence. It's been informed by lived experience. It's been informed by our work in this area for the last few years. So really, it's using that as a bit of a reference point, see where the gaps are, see what your priorities are, because I think that's something that's likely to come up, and identify that. And as I say, feed it into ongoing work around the hub, or the hub development. Feed it into ongoing conversations, but then also get a bit of an action plan to say, and this won't be the last time we want to hear from you, I guess, is part of it. So it's part of that. It's like slowly shaping. So we'll have a bit of a broad, what are the priorities? We'll identify some of those. We'll have a discussion with yourselves, Colin. Where do you want to go? And I'm assuming we'll come back to say, so this is a priority area. Tell us more about this, because we just keep want to. Just keep want to dig, and then find out until we get something good coming out of it. So I think that's in terms of immediately what we're going to do with all that information. I think that's what we want.
Perfect. Perfect. So I know from this show we are going to put this out along with those questions as well, and just I'm not going to say this for firmly this is what it'd be, but just hearing what you were saying there, the things that you're looking for are where are things going well within, and I'm going to say this within what you do. So it's really we want to hear from staff and what things are going well in regards to mental health and substance use. Let's hear about that. What do we see? What do we want to see improving? So again, whether that's from in your team group, but also, sit there quietly if you've got time when this goes out and listen to this podcast, maybe just while you're doing some other work and stuff like that. What do we want to see improving? So what would you like to see improving? And I think it's fair to say, there's nothing out of scope here. We'd quite like to hear people and their aspirations in regards to this, even if that's further down the line, but their aspirations around this. And I think, what are your priorities? I think we can have aspirations, but we also know that in the real world as well, there is priorities that we need to see actually happening now. So that might be around like a review of processes. It might be our case audits, staff engagement, whatever that might be. I think it's really important. One of the things I think is vitally important as well. When you mentioned what was happening in Dundee and Angus, we heard about our third sector colleagues who are invaluable to what we do within substance use and mental health services. And I think again, it's about how do we bring them and their conversations on board as well. Now that might be for I'm going to say, Greg, we might come back for a second podcast. Who knows? They might have us back for a second podcast, but it might be good to then take that and maybe even saying that here today, Greg, if that was okay with yourself, maybe from some of this feedback, we come back and actually share some of that with the listeners as well, because that might be a good way of actually feeding back. We're good sometimes at taking things. We're not always so good at feeding back. I'm not saying yourself from Healthcare Improvement Scotland, but I think that's maybe something we could do as well. So does that sound okay? Because you're asking us of something, I'm asking you now of something as well. If that was something we could do.
Yeah, that's absolutely great. Yeah, always happy to come and talk to you, Colin.
Fantastic. I love that. Many people say they're not happy to come and talk to me, but I'm liking the
Uh,
fact today that you are saying that. So absolutely amazing. Thank you so much. Can I just say, I'm going to ask any last sort of comments or anything last you'd like to say just before we switch off today.
Yes, I suppose the sort of call to action is be honest in your conversations, be frank. That's what I want to hear. I was speaking with someone, and this is maybe for you, Colin. Is I was speaking to someone in West Lothian who's doing something, and her advice was trust your staff. They know what's going on. Yeah, trust them to have the conversations, trust them to know the right things, trust them to do the right thing.
Yeah, I like that, and I think it's really good, and I think it's always vitally important as well. Yeah, staff need to feel trusted as well, so we need to show that as well. So I think that's a really important thing, and a really nice message to end on today. So just for myself, Greg, can I say from the man who has one of the longest titles I've ever spoken to on a podcast, I am absolutely fantastic. It's been a really nice chance to talk to yourself, and I'm really looking forward to the chance and given the permission for staff to actually sit down and take time to reflect. So enjoy the rest of your day and thank you so much for being on the show.
Thanks, it's been great to be here.
Fantastic. Thank you so much and take care, everyone. Speak to you later.